I'm a registered dietitian. Oh, I guess we're not on yet. Welcome, everyone. Oh, good. I see Leah's on, which is great. All right, I think we're ready to move. I am Joanie Risbano. I am a registered dietitian with Cigna Healthcare. I'm also a volunteer with 412 Food Rescue. I will be your moderator for today's session, from funding to food pharmacies. How do you leverage your local healthcare system? We have 3 dynamic speakers today, including Dr. Joan Eichner from UPMC, Abbe Stern from Children's Hospital of Philadelphia, and Leah Brown from the Food Bank of Delaware. So our order of events, we'll have Dr. Eichner speak first, followed by Abbe Stern, and rounding up the crew with Leah. And please hold your questions. We will certainly have time to address them after each of our speakers go. Dr. Eichner, are you ready?
I am ready, thanks.
Great.
I'm not sure if everyone can see the deck or not. I am not able to see it.
I am not seeing that yet either. One quick second. Let me see if I can. Joan, as kind of a backup plan, if we can't get these up, would you be able to use the share feature?
Sure, let me try that.
There we go. Oh, looks like we've got Abby's slides up.
Okay, hang on. I just needed to unmute there. All right. Are we okay to go forward?
I'm ready, but I am not seeing your slides up.
How about now?
I'm going to give that a quick second. There we go.
Okay. So hi, everyone. I'm really pleased to be here. My name is Joan Eichner. I'm a senior director with the UPMC Center for Social Impact. For those of you that are not familiar, UPMC is an integrated payer-provider healthcare system that is headquartered in Pittsburgh, Pennsylvania, but we operate throughout Pennsylvania, parts of New York, Maryland, and other areas. And the Center for Social Impact was created several years ago to really address health-related social needs or social determinants of health, not only of our UPMC patients and members, but for the community at large. And so what I'm going to talk about today in my slides is some of the ways that healthcare payers in particular, but healthcare systems more broadly, can work with community-based organizations and other constituent groups to address nutrition security. So, really high level, why do healthcare payers care about nutrition? Well, obviously, the folks that are attending this conference are probably very well versed in the fact that good nutrition is essential for whole person wellness. It affects every aspect of our life, from birth to end of life. It's critical for disease prevention and health maintenance, and also for our longevity and well-being. Yet we know that over 10% of the US is food insecure, and that is particularly noticeable in communities of color and in our very young population, in our older population, and for folks that are living with chronic diseases. And it is very much a health equity issue when we start to think about access to nutritious foods, affordability of nutritious foods, and the many interwoven elements that have to do with food and nutrition access. There's a lot of research out there too that shows that public benefits such as SNAP or the Supplemental Nutrition Assistance Program, enrollment in that program can really help to reduce healthcare costs and unnecessary healthcare utilization. And by that, I mean particularly folks using the emergency department, which is not an ideal scenario for the person involved, nor for the healthcare system or the healthcare payer, because it's not the right resource most of the time for folks to use. The health system really wants to encourage people to be part of preventive healthcare, to be up to date with their primary healthcare, and to really only use emergency services for true emergencies. So from the research perspective, we love looking at studies to say, wow, if we can help folks get enrolled in SNAP, this great public benefit program that they're likely to be eligible for, that's a win for us as well, because we're getting people out of unnecessary healthcare use and ultimately saving money, which is an important thing for a healthcare payer. So there are some national research studies using large population data sets that are showing that when somebody is enrolled in SNAP benefits, they are less likely to be hospitalized, less likely to enter a nursing home, and ultimately there's a cost savings associated with that, particularly in lower income adults or folks that are dually eligible for Medicare and Medicaid. So how do managed care organizations work with different partners to support nutrition and food access? There's a lot of different ways that we are able to do this. Specifically, we work primarily for our members, or those folks who have a health insurance product that we offer. So we can do this directly through designing those health insurance benefits, or what are called supplemental benefits, which aren't required benefits we have to offer, but other things that we can wrap around an individual, such as transportation supports or gift cards to provide or to purchase fresh foods. We have different over-the-counter benefits that folks can use for food access, or different types of sort of resources that they need that aren't covered in a direct benefit. But in a direct benefit for different populations, we're also able to offer things like home delivered meals or medically tailored meals, particularly for folks that are either living with chronic conditions or they've just come out of an acute health situation like an inpatient hospitalization or a nursing home transition. What we also are able to do, and this is more of an innovative exploratory mechanism, is to partner with community-based organizations to address social needs. So the UPMC Health Plan through the Center for Social Impact has what we call value-based contracts with community organizations, where we essentially utilize a community organization as an extension of our workforce, recognizing them as the experts of addressing social needs that have health impacts. So again, things like food access, housing security, transportation, and other needs. And we're able to do some innovative contracting with them to help them help us achieve our goals while they're still fulfilling their mission and receiving some new funding streams through partnership with us. We also have the opportunity to utilize statewide programs such as the Neighborhood Assistance Program, which is a tax credit program through the Pennsylvania Department of Community and Economic Development, whereby businesses are able to receive a tax credit for supporting a nonprofit organization working in a vulnerable community. UPMC does a lot of this, particularly through their food-specific neighborhood assistance program. And I believe since 2020, we've able to support community organizations somewhere in the neighborhood of about $3 million. We also do sponsorship and charitable giving towards organizations such as 412 Food Rescue and other entities that are directly providing food into communities, providing food banks, food training programs, et cetera. And finally, another way that we work in the nutrition space is around research and practice collaborations. So within UPMC, we have a specific research entity where we design and implement research projects for creating generalizable knowledge that other healthcare systems or other researchers or other entities are able to use. And we also have these practice collaborations where, for example, we can support community health workers within community-based organizations to go out and help folks access some of the social services that they might need that we feel are likely to contribute to their health and wellness. I just wanted to share this slide. This is not something that I created. It was recently published by the Institute for Medicaid Innovation, but I really like it. And it shows this partnership continuum between healthcare entities and community-based organizations. And what it's really showing us is that the level of trust between these partners increases as the amount of time and true partnership between these organizations is invested and nurtured. And a lot of times that we see these sort of partnerships, it's really more about tokenism or one-way information sharing. But when you can really invest that time and really build that level of trust, that we can ultimately work our way up this ladder for more bi-directional information sharing, more mutually beneficial partnership development, more time spent, on the ground, in person, face-to-face together, really developing those relationships. And we can, sort of co-design or co-develop mutually beneficial partnerships together that are really multi-year and longer lasting. So that's ultimately our goal, is to really invest in these community partnerships and really be able to hopefully move the needle in a meaningful way for folks with social needs. Here's a couple examples I just wanted to share. Again, I mentioned around the neighborhood assistance program and some of our sponsorships. UPMC has supported the 412 Food Rescue Cooking Matters program, as well as the conferences that we're attending today. And through our neighborhood assistance program, we were able to support the organizations that you see listed on this slide in a lot of different activities that those organizations were doing already. These are their missions and their programmatic goals, and we are able to support them through the Neighborhood Assistance Tax Credit Program. Again, a lot of these are direct service, purchasing food directly for food banks and distribution points. But some of them, such as the Community Kitchen of Pittsburgh, it's a workforce development program and training folks that want to go into to food service and food preparation. We're also able to support things like food distribution through physical plant support to physical plants and transportation, distribution, like refrigerated trucks and so forth. So there's a lot of opportunities there where not just a healthcare system, but any for-profit business could leverage this type of assistance to a nonprofit organization. And then briefly, I wanted to touch on a research example, as I mentioned. So this is something that the folks at the UPMC Center for Social Impact had worked on in collaboration with a national nonprofit organization called Benefits Data Trust. And Benefits Data Trust exists to help individuals apply for public benefits, such as SNAP, but also Medicaid. They do LIHEAP, WIC, college funding, like a number of different public benefits. They're a really interesting organization you should check out if you're not aware of them. So UPMC collaborated with Benefits Data Trust and took advantage of sort of a natural experiment that was rolling out a few years ago in Pennsylvania, where Community Health Choices, which is the long-term services and supports program through Medicaid, rolled out statewide in a phased, sort of a phased timeline. So UPMC, working with Benefits Data Trust, developed a quasi-experimental research design where we would be able to test, did SNAP enrollment have an effect on healthcare utilization and cost? And this was specifically among individuals who were eligible for both Medicare and Medicaid. So they're lower income, typically older, and or living with a disability. So what we found was a really interesting finding in terms of research or for a healthcare system. So that compared with a propensity score matched control group, the folks that were enrolled in SNAP had 16% and 21% lower total healthcare costs and pharmacy costs 1 year and 2 years after receiving the SNAP enrollment. And that's a significant savings for a healthcare payer. That's something we really take notice of and say, wow, like there's something going on here. And so, my point in sharing this is that there is a business case and a financial advantage or ROI to having a large healthcare system or somebody with an enormous amount of resources, such as UPMC, to really leverage our power to be able to say, hey, we should help support our members to get enrolled in this public benefits SNAP. And so this particular research study has led us to develop a multi-year partnership with Benefits Data Trust, who is now outreaching to all of our Medicaid members to help them with benefits enrollment screening and support should they want it, as well as referrals to social needs when that is warranted. So to wrap up here, I just want to share a few action steps. And this is really written from the perspective of somebody that wants to partner with a health system or payer. So healthcare systems can impact individual and community level nutrition security. There's a lot of different partnerships options there that I've kind of gone through quickly. So if you want to explore a partnership, really think about if you're in a for-profit business, are we leveraging tax credit potentials? Do we have charitable giving programs? Really understand what your health payer or health plan offers in terms of nutrition benefits. There can be a lot there to support folks who are having nutrition insecurity. And what I've written here is never waste a good requirement. So this is something that we sort of say at the Center for Social Impact, where it's like sometimes these regulations come down for the healthcare industry, such as the value-based contracting with community organizations. And it is a real opportunity for us to get creative to figure out how we can get money into the community to help address social needs while also sort of checking the box of a requirement that we have to meet. Community organizations are natural partners for healthcare systems. They have on-the-ground expertise. They have trust and access with the folks that often healthcare system is not able to reach for lots of good reasons. And so, really think about what community organizations are doing high quality work in your area and how many of them are working in the communities where you have a good number of members or patients that you're trying to reach. You probably have aligned goals, and there's an opportunity there to figure out how you can blend and braid your resources. Finally, SNAP enrollment can positively impact health and reduce unnecessary healthcare utilization and cost. And again, that is a big business case, a big area of interest for somebody like a healthcare payer or healthcare system. And so there's a lot of opportunities there to think about how we can leverage access to public benefits when folks are eligible for them, but also might not be enrolled. So thank you. Those are the end of my slides.
Thank you so much, Joan. Please forgive me. I failed to give you a proper introduction. I know you shared your background, but I meant to do that earlier. There was one question that came through the chat, and I'm going to break form here and address this now because it ties in with your slides. But how does SNAP apply if the organization is not based in the area but does work there? That came from Victoria. So how does SNAP apply if the organization is not based in the area, like a community organization or a healthcare organization? I'm not quite sure.
Okay. Well, the SNAP benefits are determined at the household level. And so in our example, an individual or household is eligible regardless of where they are located. They just have to work with the administration of that program in this state. But in our example, what we did was utilize our UPMC member services outreach folks to work our Medicaid member call list and then refer folks to Benefits Data Trust, which is able to work with anybody, anywhere, multi-state, to determine what public benefits they are eligible for and then assist in that enrollment if needed. So there could be multiple pathways into that benefits enrollment assistance. And SNAP specifically, folks can apply on their own or through lots of different pathways. It's just that the application process can be confusing and can be an unnecessary barrier for a lot of folks. So I'm not sure if I answered that question, but our role in it really was to help facilitate getting through some of those barriers of enrollment into the program when we were pretty sure folks were eligible.
Great. Thank you so much. Okay, we are going to move on to Abbe Stern. And as her slides are pulling up, I will give you a proper introduction. So Abbe Stern is the Food Pharmacy Manager and Food Justice Program Coordinator for the Center for Health Equity at Children's Hospital of Philadelphia. Prior to 2020, Abbe worked in the hospitality management, directing operations and events at the Rittenhouse Hotel, where she started a nonprofit called Fooding Forward that dealt with food recovery from hospitality events, which then went to feed communities in need. With the onset of COVID-19, Abbe transitioned to working for the Broad Street Ministry and the City of Philadelphia, where she managed the city's outdoor meal program, Step Up to the Plate. This is a prepared meals program that sent restaurant meals to nonprofits who would then distribute the meals into the community for free. So I'm happy to have Abbe join us when you are set, and I believe we've got your slides pulled up and ready to go.
Thank you, Joanie. Hi, everybody. I apologize. My camera is not working, so you will just have my voice today with the slides in the background. But again, my name is Abbe Stern. I am the food pharmacy manager over at Children's Hospital of Philadelphia, as well as the food justice program coordinator for the Center for Health Equity. And to begin the presentation, I'm going to go into a little bit of my background as to how I got here and how I'm able to manage these pharmacies with kind of my background. So back in 2018, I started a nonprofit called Fooding Forward, which recovered prepared food waste from hotels and restaurants. In 2020, I lost my job in the hospitality industry, and my nonprofit became very relevant very quickly. And I, in addition to a few other food rescue organizations, to include Food Rescue Hero, went out and rescued as much food as we possibly could from all the shuttering businesses. And then everything kind of got quiet. I worked then for Broad Street Ministry and as well as the city of Philadelphia to manage Step Up to the Plate, which was their reaction to COVID, where we ordered prepared food from restaurants to then be sent to different outdoor meal sites, who then these different nonprofits would distribute that food. And they already were in those communities. They were working with those people. They understood what they needed, and we were able to kind of just get food to those locations so that the nonprofits would then be able to distribute them. Throughout all of this, I kind of was able to see the different sides of operations and how food moves through different programs. With food being something that's tangible and something that uh, has a shelf life, it's very different than working with medical equipment or any other kind of good with that kind of shelf stable quality to it. Back in then 2021, I started working for a children's hospital as the food pharmacy manager for their food pharmacy program. The food pharmacy program at Children's Hospital started in 2018 and was formed by Dr. Saba Khan, who was the medical director of the Healthy Weight program at that time. And the Healthy Weight program was a program that works with families who have children that are obese and gearing them towards healthier lifestyles from a very 360 approach. So they work with a nutrition, a dietitian, and a exercise physiologist. Throughout this program, Dr. Khan realized that with families that were coming into the clinic to kind of work on their obesity, she also realized that we were kind of setting them up for failure in a sense of telling them they need to eat fresh fruits and vegetables, but then sending them home where they live in food deserts and they didn't have access to those fresh fruits and vegetables that were needed to then be part of this program, being the Healthy Weight program. So she started the food pharmacy back in 2018, where there was an actual pantry inside the Healthy Weight clinic. So there were refrigerators and cabinets. The cabinets had shelf-stable goods like rice and oats and applesauce and cans, whereas the refrigerators had produce and milk and other dairy goods. And then 2020 hits, the clinic shuts down, and we are no longer able to get food into to the families when they're physically coming into clinic, as everything then turns to telehealth. So during this time, there was a big transition within the program of how do we continue to get food to our families, knowing that the families are not coming into the clinic and not able to receive that food. And I'll take a step back. For families to receive food when they were in the clinic prior to 2020, we implemented screening questions in the pre-visit paperwork that the families received. So we would use the 2 USDA food insecurity questions. If you're all familiar with them, and if not, they are kind of related around within the past 12 months. Was that family able to either access food, or did they have trouble getting food after food may have run out? And if a family answers yes or sometimes to either of those questions, and those questions again being how are they sourcing food, and if they're having difficulty with that, they are automatically allowed to participate in our food pharmacy. And to participate, they would do it once a month, be able to go into the pharmacy after their appointment, collect a bag of goods, and go home. Fast forward to 2020, when we physically aren't seeing patients in the hospital and everything is moved to telehealth, we then implemented a delivery model and worked with a food rescue organization that would then pick up the food from our vendors and deliver it directly to the families' homes, which the families really enjoyed, especially during this time where food was so scarce and getting food was a issue. The delivery model was greatly impactful for our families. And we decided that when we did come back in person, that we were going to keep the delivery aspect available as it was so beneficial. More families were able to then get produce to their homes. And then we were also able to expand the program. So we were no longer only operating within the Healthy Weight program. We could then start looking at other clinics and other buildings to move our service. And at that time, we expanded into the CareBots Primary Care Center, which is at 48th and Market. Fast forward to 2021 when I joined the team. And now we have the Healthy Weight Pharmacy, which is located at 3550 Market, and the CareBots Pharmacy, which is located at 48th and Market. I then kind of was able to see our existing operations, what we were currently doing, how we were screening families, how we were then getting the food to their families, and what resources we were also offering. At this time, the program itself was a 6-month program where once a family was enrolled, they would get a CSA box of produce delivered to their homes the last week of the month, as well as a dry bag of pantry goods delivered to their home once in the beginning of the program. I kind of saw this and was thinking, how can we grow the program? How can we make it sure that we're meeting the need in other areas of the hospital, knowing that CHOP is very large and we're in different corners of the city, different corners of the state. How can we expand this program from outside of the Healthy Weight program and screening at CareBots? And then how can we implement choice? Knowing that choice is such a huge component of either feeding yourself or really having that ownership around what you're eating. How can we have these families making their own choices, knowing that right now we're just giving them product? And when you give anyone product of food, there's a statistic that there's about 40% of waste that happens when families are just given food because they either don't like it or they don't know what to do with it, or it might just be foreign. They might not know what it is. I mean, actually, you can move to the next slide. I may have jumped over a few things, but everything's just kind of related back to the food pharmacy at CHOP. There we go. And you can go to the next one as well. Thank you. So the program itself was running well, but I saw opportunity for expansion as well as how can we differentiate our offerings. I had heard from families that sometimes they did not want to enroll into the food pharmacy because their child was a picky eater and they didn't like canned goods or the produce that they received. They didn't know what it was or how to use it. And for them, it was so much harder for them to waste food that they didn't want to become part of our program. It's like, we do need it. We do like some of the items, but it's so hard for us to not be able to use everything that we don't want to then take this away from someone else. And upon hearing that, I was okay, we need to implement choice, and how can we do that? So I went to our current vendor who we're purchasing items from, and I asked, how can we work with you to either build a website or be part of your existing website where families can go online, pick the items that they need, and get it delivered to their homes while we're still kind of paying for that bill. And then at the same time, what education can we then build around our program so once our program ends, this family is still set up for success in the future? And so I'm excited to announce, and this is what's currently happening right now at the food pharmacies, of what we're in the process of kind of moving towards, is a system of choice where a family will be able to go online, pick the items that they want, check out, potentially use their WIC and SNAP if they have those items to be able to beef up their order and check out to get it delivered to their home. Part of our resource navigation with this program as well is that when you do enroll into our program, we ask, are you part of WIC? Are you part of SNAP? How can we get you into those programs if you aren't already? And that knowing that you might be food insecure, what other items within your life or what other aspects of your life can we help with? Do you need help with financial planning? Do you need tax prep? Do you need access to other free food sites in the area? Do you need help with grocery shopping? Do you need assistance with meal planning or reading a nutrition label? And we try to go through this kind of menu of all these different food and financial resources that our families might need, knowing that they're experiencing this food insecurity situation at this time. So with the new rendition of our program, what I'm hoping to, and we're also expanding to our Norristown Primary Care Center in the suburbs, as well as our Cobbs Creek Primary Care Center in the Cobbs Creek neighborhood in West Philly. We're hoping to really implement choice and then bring that resource navigation in a little bit more depth to try to meet that 360 approach of what this family might need and how they landed with us in the first place. And so with that resource navigation, speaking about the financial resources, we're now also offering period products. So with our families that have any menstruators in the household, not just the child themselves, if anyone was in that situation that also needs period products, we are also including that in our resource navigation. So we ask our families, knowing that you may have trouble sourcing food, is this also a trouble for you? Can we help with this as well? And see how does that affect their financial situation so that if they're financially not having to worry about menstrual products, are they able to buy food? Are they able to buy more medication? Are they able to fix something in their home that they weren't able to otherwise? And then work with that family to really see what kind of money are we saving them in the long term, and how has either ordering the food in this way or receiving their food in this different way affected any of those other aspects of their life. And then you can move to the next slide. And this is just a little bit more about the food pharmacy and Dr. Saba Khan, who started the program. You can move to the next slide. Great. And so in terms of action steps, if you are looking to start your own pharmacy, it's kind of, you have to kind of do all of these at once, but I tried to put them in order of what I thought made the most sense. So you need to kind of create a workflow. What are you either looking to do, or if you already have a food program, how can you expand it? Or if you don't have one, how can you even just get it into your facility? To do that, you need to build partnerships. So are you getting the food from an outside vendor? Are you working with a nonprofit like a food pantry who might be providing the food? Are you working with a grocery store who you're purchasing the food from? Or do you have a funder who is either a grocery store or a outside philanthropist who's providing the food for you? And then based off of that, how is the food going to flow within the organization? Is the food going to physically be there? Is there going to be a responsibility of someone to hand the food over to the family once they screen positive? Is this going to be a program similar to mine where we call the family potentially after the fact and then have to deliver the food to that family? And then with all of those aspects, what do you then need to get that food there? Do you need to work with a food rescue hero to get the food to the family? Do you need to work with an Uber Eats or a Giant Direct to get the food to the family? Is the family picking it up in the hospital itself or the community organization itself? And then the funding. That's typically the biggest thing. You need funding to make this happen. We are lucky at CHOP that we have a, a gift that is funding this particular program. I know other organizations are working with corporate funders, other organizations are working off of grants, and some organizations have funding built into their systems that are willing to pay for programs like this. That is, I'm hoping in the future there's more and more of that funding baked into these organizations to prop up these kinds of programs. But this is something that is what I like to kind of say, a newer industry, and there isn't as much of that existing funding. You kind of need to create it. There is hope, and I'm very optimistic that this kind of funding will be more available as in the future, but it is something that needs to be, you do need to get a bit creative at this time. And then once you're able to get something up and running, market what you're doing and get people excited about it. That's who's going to continue to prop your program up. That is how you're going to get additional funding when people hear about what you're doing, and how can they help? How can they get involved? And if they can't give you monetary donations, are they able to donate grocery bags? Are they able to donate their time to help build the grocery bags if you're distributing out of your own facility? garner that excitement and get people passionate about what you're doing, because that will absolutely keep it alive and generate more funding that you might not have seen in the past. But so I will stop there if anyone has any questions.
Abby, thank you so much. A couple of questions have come through. I originally thought I was going to hold questions until everybody spoke, but because this is directly to you, I would like to address that as well. Question about funding. So I think you kind of addressed that with your last slide, that you are fully funded by Children's Hospital of Philadelphia through a gift that funds the food pharmacy. Is that correct?
That is correct. So as of right now, we are funded by an outside funder from Children's Hospital that they gave the gift to Children's Hospital to fund this very specific program. But so technically, Children's Hospital isn't funding this themselves. It is an outside gift.
Okay. And then just like some of the logistics then, like staffing, are you the only staff person? Are there other staff members that this gift also provides support for?
Thank you. Great question. I manage the programs, and I have a resource navigator who helps enroll the families and then goes through the resource navigation with each family during enrollment. And so the way that we enroll our families, they screen positive for food insecurity. My resource navigator then pulls the list of who might have screened during their appointments and then who also consented to follow up. That's a big proponent as well. We do say, hey, we have this program. Are you interested in learning more? Yes or no. We're going to have someone call you. And then that person needs to say yes for us to then call them back. So we'll say
Okay.
yes. If they say yes, we would like to hear more. My resource navigator then calls them, kind of goes through the program with them. And if they're still interested, she then goes through the enrollment, which is selecting their delivery day and collecting their information and kind of going through the authorizations that we might need to then send this information to our delivery partner so that the delivery partner then can be in contact with the family when they're delivering the food. And I should also say this person who is my resource navigator, I share her with another department. So we have the medical financial partnership, which is another social determinant of health program at CHOP, where families can work with the medical financial partnership to do tax prep, basically, to help
Okay.
them get as much back with their taxes. And so we directly partner with them so that any food pharmacy family can also then receive all of the resources associated with the medical financial partnership. But that resource navigator is enrolling, who we share, enrolls all of the food pharmacy families and all of the medical financial partnership families. So she's cross referring all of those families to both programs as she's kind of getting referrals from those families for either program. Once
Thanks for
they are
addressing that. That was actually one of my questions, if the navigator was aligned directly to yours or dedicated, I should say, or if she does other work with other programs. So thank you for clarifying that.
And she has a social work background as well. So that's very important for that role. We always make sure that they have that training, knowing that these families are experiencing a onslaught of things that if something were to come up, she'd be able to then hear that and then get that family the help that they need throughout the system.
Got it. And perhaps I missed this, but I think you referenced food delivery. So are the food being delivered directly to your recipients, or are they going to a central food pharmacy to pick it up?
So kind of both. The Healthy Weight Food Pharmacy is still operating. We do have the in-person component still available for the families who are coming into the Healthy Weight program. But then the entirety of anyone enrolled into food pharmacy, everyone is getting delivery directly to their homes of the fresh food. So the CSA box that we order, which is coming from Common Market, that box gets delivered directly to the family's home. And the reason we separated the fresh and the dry is knowing that with the fresh, obviously it's fresh. The time stamp is the most important, that we need to have no kind of in-between time of the food sitting in our facility before it gets to the family. It's drastically helped us reduce waste. And then it's bulky, and sometimes the produce is heavy, so it's easier for families to get that delivered directly to their home. Whereas with the pantry goods, we're able to store that in the clinic. We're still able to deliver that directly to families' homes. So the families who aren't coming into the clinic But for the families that are coming into the clinic, and this is something I'm trying to now also expand to all of our pharmacies in our different buildings, there needs to be a in-person food component, knowing that certain families are walking into that building and they need food right now, and they're going home to potentially a home without food and potentially without utilities. So just to kind of give a sad story about a mother who I dealt with once. She was coming into the clinic and she's like, I do like your program, but I really don't need the fresh fruits and vegetables. I don't have time to prepare them. I work 3 jobs, and then my son has some feeding issues, and and in my kitchen right now, all of our utilities are turned off because my daughter put her foot through the kitchen floor, which is we're on a second floor apartment building. So then it went through the ceiling of our downstairs neighbor. So we had to turn all of our utilities off because of the repairs having to go on. So I don't have a microwave. I don't have a refrigerator. I need to open up a can so I can feed my kids. And so we made sure she was sent home with as much as she could take, as much as she wanted, but she needed those cans. She needed the food that she could eat right then and there. And that's also prompted us to look into prepared food as well. But you need both. And for the family who is typically in that dire emergency situation, it is more beneficial to have something that can open up ready to eat, whether it's a can or a prepared meal, versus a whole piece of produce that they would either need to prepare or wouldn't have the full picture of what that family might need in that time.
Got it. Yeah. Thank you. I think I definitely have more questions on this, but we do need to move on to our next speaker.
Thank you so much.
Yeah, thank you. We are moving on to Leah Brown, who is a registered dietitian and currently the Community Nutrition Director at the Food Bank of Delaware. She began her career at FBD in 2013, first as the Child Nutrition Production Manager, and was promoted to Lead Community Nutritionist. In this role, she was responsible for management and implementation of the SNAP grant. And after 3.5 years with FBD, Leah went on to gain nutrition counseling, private practice experience, and additional medical nutrition therapy expertise in clinical nutrition. She was asked to return to the food bank in 2021 and now oversees management and implementation of both the SNAP Ed grant, women, infants, and children nutrition education outreach contract, and she works with her team on other FBD departments to include nutrition initiatives throughout food distribution operations. Leah, please take it away.
All right. Good morning, everybody. Just thank you, Joanie, for the introduction. Thank you guys just for inviting us, the Food Bank of Delaware, here for this conversation and having me here today. There are, I believe, some slides. I don't have a lot of slides, so I'm just going to start talking, I guess, and hopefully we'll be able to answer some questions. So I was asked to be on here today basically to discuss the Food Bank of Delaware's partnership with Bay Health, which is a local hospital system here in the state of Delaware. If anybody doesn't know anything about Delaware, we are the second smallest state. So the state of our president, where Uncle Joe, we like to call him here, is from. We have 3 counties and just over 1 million people. So not really huge, but even so, the Food Bank Delaware, within the state of Delaware, we have about 1 in 10 people who are food insecure, and about 1 in 7 of Delaware children who are food insecure. So over 100,000 people who suffer with food insecurity. And here at the Food Bank of Delaware, our overall vision is a community free of hunger. And our overall mission statement is to inspire hope in our communities by providing food to nourish Delawareans with it while collaborating on long-term solutions to hunger and poverty. So here at the Food Bank, we attack food insecurity 2 ways. We call it, one way is our Food for Today, which is our food distribution programs, and then Food for Tomorrow, which is workforce community development programs, which is more about that long-term solution. So our partnership with Bay Health falls into that food distribution, that Food for Today system. So it's really unique. And I don't know if the slides, the couple slides that I do have, if they could be posted, just the second one. But this partnership is unique in that, we are the first in the nation to have a statewide food rescue program called 302 Food Rescue, and that launched November 17th of 2022. And the way it worked out was actually the American Heart Association had approached Bay Health, and they were talking early in the summer of 2022 just about more ways to get healthier foods, get healthier foods within the community. And actually, then they approached us, the Food Bank of Delaware, to do this work, to partner in this work. So the greatest thing about the food bank, we cannot do the work that we do without community partnerships and without our volunteers. And so the 302 Food Rescue, which is an app, is really unique because it allows us to do even more of that community partnership and volunteers working together. So without Bay Health and without American Heart Association, we just, in the power of technology, we wouldn't be able to expand on this. So as you can imagine, as a food bank, we already are doing food distribution. And so we have our trucks and our tractor trailers who are like picking up foods from donors, grocery stores, and things like that, and distributing out to our partners. But what the app allows us to do in a really unique way is it gets the community involved to where basically what happens is, like, you can sign up for this app. You can go to the app store right now and look up Food Rescue Hero, and a person in the community can sign up to be, we call them a 302 Food Rescue crew member. And so what happens is they can select the area that they would like to do food rescues in, and sign up for duration or how many or how often they want to do it. And then whenever there's a food rescue available, that person will get an alert and they'll be able to go pick up that food from a local restaurant or from a local grocer, and then deliver it to a community partner that we have identified. So the Food Bank of Delaware, we have about 700 community partners. And so what's really unique about this, so just as a small success story, one of our local community centers has a bus to transport seniors. And so there's just some loads that come from grocery stores and whatnot that aren't substantial enough for us to utilize our trucks to make that pickup. So they were actually, using their bus for seniors to pick up food instead of being able to use their bus to pick up and transport seniors. So the 302 Food Rescue app has been invaluable in that way till now. There's someone in the community who is now able to pick up those smaller loads and deliver them to the partner in the community, the Rosehill Community Center. So now they can use their bus for transporting seniors. So that's just a small thing. It's just really unique. They approached us because, what we already do. But I think that the way it went originally was that the American Heart Association had approached Bay Health, and then through their talks, then they approached us. And so it really began early summer 2022. And then they began to work with our director of technology and inventory on creating this app and figuring out how it would work within our system. And then kind of the rest is history. So since November 22, when we actually launched, we have been able to rescue, I believe, around 300,000 pounds worth of food, and about 20% of that is about produce. And we've had over 1,500 rescues so far, and those were done by 139 volunteers. So it's really been a great expansion upon our work, and so we wouldn't be able to do it without Bay Health. So Bay Health has been integral as well because they are our funding source. And so Abbe talked earlier about needing a funder, and so Bay Health is actually backing the licensing for us to be able to use this app to do this work. They have been with us in it the entire time. They do a lot of marketing for the program. They provide billboards within the community for the program to get people to sign up to be volunteers. And that's pretty much it. It's really unique. And so I think we can see profoundly, like last year, we distributed about 16.5 million pounds worth of food. And now, in our fiscal year at the Food Bank of Delaware runs from July 1st to June 30th. So we started food rescue in November 2022. So the year before was 16.5, and so this past year that just ended, we were able to distribute about 20 million pounds of food. And so I think part of that additional food is probably from being able to have this partnership with Bay Health and the American Heart Association to be able to do this work. So as far as action steps, what I did have on the slide was to find your champion, right? And make, and that's either through making connections or utilizing your network. So in a way, this is really unique because we didn't really start the work. They came to us to partner, and we were like, yeah, this is an extension of what we are already trying to do with our vision and our mission. And so, but I think we already have a healthcare partnership with Bay Health that ironically started in 2022 as well, where Bay Health themselves were seeing that when they were screening for social determinants of health, that food insecurity was in their top 3. So they actually became an agency partner with us where they are doing, we have a box that we create here called a nothing added box. There's no salt added to the canned vegetables and no sugar added to the canned fruit. And then there's like oatmeal, whole grains, whole grain pasta, whole grain rice, brown rice. And so what it is they've been doing that through their discharge. And they started with oncology, and then they started with their inpatient, and now they're moving on to their primary care. So we already had that relationship of doing that work. And so I think probably when American Health Association reached out to them, it probably made sense to continue that work with us because, we're on the same page. So I think if you have the like-mindedness and you have this is really about relationships and expanding those relationships. And if you can find a champion within that healthcare organization who's on the same page and wanting to do this type of work, that's kind of where you start. And then kind of seeing what's going on. And then hopefully, if they'll be willing to fund it like Bay Health was for us. But yeah, it's really a unique situation, not like, most others. So if there's any questions or anything that I didn't say that someone wants to know, I'd be happy to answer if I can.
Yeah, Leah, thank you so much. I have not seen any questions come through the chat specific to you, but appreciate the offer.
No problem.
We are going to wrap up very shortly, so our next group of speakers can go, but there is a quick question that came through about connecting with speakers. I believe on the left-hand side of your screen, there is a link for speakers, and I believe you can go through there to make a connection with any of the speakers lined up today. So thank you to all 3 panelists today. Lots of great information shared. That's a wrap for now.